from chronic migraines, we're going to help you with a new cure. That's all coming up on the Fox 5 Morning News.
Botox is now approved for more than just curing those fine lines and wrinkles.
Our Heather Ford is in Encinitas this morning to show us a little how it works. Hey, Heather.
Hey, that's right. We're going to show you how this all works because Botox to cure migraines has been approved by the FDA. Our neurologist who's on hand this morning is going to show us how this works, Dr. Andrew Blumenfeld. So, doctor, we're injecting one of our patients here with the actual Botox this morning and showing how you would do this. Now, if you were going to go get this done in a dermatologist office, this is not where you would get the injections done. Is that correct?
Absolutely, yeah. These injections are in very specific locations that are very different from what we do in our cosmetic treatment. So if we were injecting someone cosmetically, we would not be in these same locations. A lot of the injections are on the temple, the back of the head, the neck, and the shoulder regions. Very few are actually over the forehead region. And these are points where there are nerves that have come up to the surface of the scalp, and we're injecting around those nerve endings to dampen them down. And this is going to, as I mentioned earlier, work for about 3 months as the medication blocks these nerve endings.
So what do patients need to know? They would come in and this would be a completely different procedure as opposed to what would happen if you went to a dermatologist's office. There's much more involvement here.
Absolutely. If you don't inject in the correct locations, you don't get the same effects, and you could get side effects like neck weakness and neck pain. Okay. And it's very important that you learn, as a physician, the correct areas to be injecting. This is a treatment mainly done today by neurologists specializing in headache.
And Sadie, how old are you?
I'm 23.
23. So Sadie, does this hurt when you come get it done? You have to get it done every 3 months. There's like 30 plus injections that happen. So when do you start to feel relief?
It takes about a week or two before, but I don't really have that many headaches before or migraines before I start coming in.
Okay.
Because I get it frequently.
Yeah, so you get it done very frequently. Let me know a little bit, what do patients need to know about this? If they're seeing it this morning and they're wondering, yes, I have chronic migraines, I'm having issues, but they don't know that Botox is the best thing for them.
Sure. Well, the important thing is that you need to be having lots of headache in order to qualify for this treatment. Insurance companies are covering this if patients have more than 15 days a month of headache. So patients with migraine more than 15 days a month can get Botox as one of the methods of controlling their headaches. This is done every 12 weeks.
Okay.
So usually the injection procedure takes us about 15 minutes. Patients can go back to work. There's no problem in that. You don't have a downtime. You might get a little bruising at some of the sites. But then it'll slowly start working over the course of the next week or two. Okay. And generally the headaches will come under control for the full 12-week period. Okay. And then we need to redo it. Okay. Usually this will go on for about a year to try and get the headaches under control.
All right. Thank you, doctor. Very good information. For now, I'm going to send it back to you guys in the studio.
Nothing like some sharp needles to get you going in the morning. Thank you, Heather. We appreciate it.